Hello friends, welcome to my channel Study Anatomy. In this video, we will discuss about what is mandible. As you can see in the picture, there is a skull which consists of the orbital sockets, then the nasal area, then the upper jaw which is called as the maxilla and the lower jaw which is called as the mandible. In this video, we will focus on the mandible which is the lower jaw, and it is the largest and the strongest bone of the face. This picture shows the landmarks of the skull. Do you know what are the features of mandible? So let's start. The mandible is called as the lower jaw, and it is the largest and the strongest bone of the face. It develops from the first pharyngeal arch. So when we see the mandible, it appears as a horseshoe shaped body which lodges the teeth in the sockets. So the mandible consists of three parts, that is the body, and there is a pair of rami. Let's discuss one by one. First is the body. As you can see in this picture, there is a presentation of the body of the mandible. Of the mandible, it is horseshoe shaped. Each half of the body has outer and the inner surfaces and the upper and a lower border. First, we will see the outer surfaces, which presents the following features of the mandible. First, there is a mental prominence which is also called as the mental protuberance. In this, the mentum means the chin. So this is present on the chin area, and it is a median triangular area which is projected in the lower part of the midline of the chin region. Then secondly is the mental foramen, which lies below the interval between the premolar teeth. This mental foramen allows the foramen to pass through it. Then there is a marking which is called as the symphysis menti, which is the line at which the right and the left halves of the bone meet each other. It is marked by a faint ridge, that is, when both halves of the mandible they join, then there is a ridge is forming which is faint, and this ridge forms the symphysis menti. Then the oblique line. As you can see in this diagram, there is an oblique line. This oblique line is a continuation of the ramus. It is the continuation of the sharp anterior border of the ramus of the mandible. It runs downwards and forwards towards the mental tubercle. As you can see in this diagram, there is a marking which is called as the mental tubercle. We have talked about the key features of the outer surface of the body of the mandible. Now we will discuss about the inner surfaces of the body of the mandible. First, we will talk about the mylohyoid. Mylohyoid line is a prominent ridge that runs obliquely downwards and then forwards from below the third molar tooth to the median area below the genial tubercles. You can see in this diagram that the mylohyoid line is running below the third molar. It is going to the median area towards the genial tubercles, and then it goes below to the genial tubercles. There is an area which is present below the mylohyoid line. This surface is slightly hollowed out to form the submandibular fossa. What do you mean by the fossa? Fossa is an area in which a particular tissue get lodged, then which lodges the submandibular gland. You can see in this picture there is a submandibular fossa. This is a hollow space, and in this hollow space the submandibular gland gets lodged. There is an area which is above the mylohyoid line. This above the mylohyoid line area, it is called as a sublingual fossa. It is called as a sublingual fossa because it lodges the sublingual gland. The sublingual gland lies in this fossa. Other marking of the inner surface of mandible is the inferior and the superior genial tubercles. Posterior surface of the symphysis menti. It is marked up by the four small elevations, that is, called as the superior and the inferior genial tubercles. See in this diagram, there is a two markings on the superior surface and the lower surface called as the genial tubercles. They are present in the backward area of the symphysis menti, as we have earlier studied that the symphysis menti is present on the outer surface of the body of the mandible. There is a marking which is called as the mylohyoid groove. It is present on the ramus of the mandible. It extends onto the body below the posterior end of the mylohyoid line. So these are some of the key features of the inner surface of the body of the mandible. There is also a marking which is called as the digastric fossa. So near the midline, the base shows an oval depression which is called as a digastric fossa. So in the body of the mandible, which is a horseshoe shaped like structure, it consists of the two borders, that is the upper border, which is the alveolar border, which bears the sockets for the teeth, and then there is a lower border of the mandible which is also called as the base. Lastly, we will discuss about the ramus of the mandible. You can see in this diagram there is a marking which is the ramus, which is related to the parotid gland. So this portion is called as the ramus area. So ramus, it is a quadrilateral in shape and it has two surfaces, that is the lateral and the medial surface. In the diagram, the portion which we are seeing in front, it is the lateral portion, and in the backward area is the medial portion. There are four borders of the ramus: the upper, the lower, the anterior and the posterior. There are two processes, that is the coronoid process and the condyloid process. We will discuss the two surfaces, the four borders and the two processes of the ramus of the mandible one by one. First, the two surfaces, that is the lateral and the medial. As we can see in this diagram, the lateral surface of the ramus of the mandible, it is flat and it bears a number of oblique ridges. After that, the medial surface. The medial surface of the ramus of the mandible, it constitutes the mandibular foramen, the mental foramen, then the mylohyoid groove. You can see in this diagram, the mandibular foramen lies a little above the center of the ramus and it lies at the level of the occlusal surfaces of the teeth. Mandibular foramen, it leads into the mandibular canal which descends into the body of the mandible, and it then opens at the mental foramen which is present at the outer surfaces of the body of the mandible. That there is a presence of the lingula. Anterior margin of the mandibular foramen, it is marked up by a sharp tongue-shaped projection which is called as the lingula. This lingula is directed towards the head or the condyloid process of the mandible. That comes the mylohyoid groove, which begins just below the mandibular foramen and it runs downwards and forwards to be gradually lost over the submandibular fossa. We will talk about the four borders of the ramus of the mandible. Firstly, there is the upper border of the ramus which is thin and it is curved downwards, forming the mandibular notch. Secondly, there is a lower border which is the backward continuation of the base of the mandible. Posteriorly, this lower border, it ends by becoming the continuous with the posterior border at the angle of the mandible. Anterior border, it is thin, while the posterior border, it is thick. Let's discuss about the two processes, that is the coronoid and the condyloid process. Firstly, the coronoid process, it is crow's beak-like structure. Anterior border, it is continuous with the anterior border of the ramus, and the posterior border bounds the mandibular notch. Nextly, the condyloid, which is a knuckle-like shape. It is a process, it is a strong upward projection from the posterior superior part of the ramus. Upper end, it is expanded from side to side to form the head of the mandible. So this is a clear picture of the mandible. Thank you so much. So if you like my video and if you have any doubt, do comment me in the comment section. And please like, share and subscribe to my channel.